Exercise Education Cardiac Rehabilitation. Stillwater Medical Center. Total Health. Megan Wilson, MS, FC. Objectives. Discuss the components of physical fitness and apply them to an exercise program. Identify recommendations for cardiovascular and strength exercise for health benefits. Identify and discuss how to self-progress a cardiovascular and strength program. Identify the appropriate exercise intensity. Discuss signs to look for when overexerting and signs and symptoms to stop exercise. Background, exercise and mortality. Only 48.8% of all Americans get the recommended amount of exercise, CDC. Over half of the U.S. is not meeting the exercise guidelines. Exercise is beneficial in the prevention and treatment of some chronic diseases and disabilities. The appropriate amount of exercise reduces the risk of cardiovascular disease and risk factors such as hypertension, cholesterol, diabetes, and stress. The figure shows reduction in mortality based on physical activity, for example, activities of daily living. Exercise and mortality. This figure shows the reduction in risk of mortality or death. It compares the percent reduction with exercise minutes in different modes of exercise such as walking or running. Components of fitness, cardiorespiratory fitness. The ability to perform large muscle, dynamic, moderate to vigorous intensity exercise for prolonged periods of time, muscular endurance. The muscle's ability to continue to perform successive exertions or repetitions against a submaximal load. Muscular strength. The muscle's ability to exert a maximal force on one occasion. Flexibility. The ability to move a joint through its complete range of motion without pain. Each component will be discussed in greater detail during the presentation. Cardiovascular exercise goal. Do you know the recommended weekly time goal for moderate intensity exercise? What are some ways that people can reach that weekly time goal? Recommendations. Recommended amount of moderate intensity cardiovascular exercise is 150 minutes per week. Ways to reach the goal: 30 minutes per day, 5 days a week. 10-minute intermittent bouts throughout the day to equal 30 to 40 minutes. 40 minutes per day, 4 days a week. 50 minutes per day, 3 days a week. It is important to remember that this is the minimum goal for heart health. People can exercise more than 150 minutes per week. It is also important to know that if you have a weight loss goal, then you may require more time or intensity. The F.I.T. principle for cardiovascular exercise. Frequency. How often? Most days of the week, 5 to 6 days. Intensity. How hard? RPE of 11 to 17. Time. How long? 45 to 60 minutes. Type. What kind? Walking, biking, swimming, etc. The goal when starting an exercise program is to start out exercising light to somewhat hard and progress to exercising somewhat hard to hard. Rated perceived exertion, RPE. Monitor the total amount of exertion combining all sensations and feelings such as stress, effort, fatigue. Level should be adjusted to reflect. RPE 11 to 16, light to hard. Correlates with the appropriate heart rate. Maintaining level will give you maximum benefits from your workout. Exercise guidelines. 2 to 5 minute warm-up. Exercise most days of the week. Increase exercise time up to 45 to 60 minutes per session. Increase exercise intensity each week as tolerated. Change exercise routine slightly every 6 to 8 weeks. 2 to 5 minute cool down. Exercise guidelines for diabetics. Never exercise when blood sugar is less than 100 mg per deciliter or greater than 250 mg per deciliter. If blood sugar is below 100 mg per deciliter, eat a snack about 30 minutes before you exercise. Do not inject insulin into a muscle you will be using during exercise. Do not exercise if you are ill. If you feel funny, irritable, fatigued or nervous prior to exercise, check your blood sugar. If beginning an exercise program, check your glucose often. Exercise can decrease your blood sugar up to 24 hours after exercise. If planning an unusually large amount of physical activity, be prepared to eat additional food or reduce your insulin. If choosing the former, light snacking every 30 to 60 minutes will help ward off insulin reactions. Be prepared for low blood sugar, carry snack or candy. Try to exercise at about the same time of the day to facilitate planning. Signs of overexertion: prolonged fatigue, extreme shortness of breath, not sleeping well at night, elevated heart rate persisting 10 minutes after exercise, chest pain or discomfort, pain in joints, flare-up of arthritic condition, abnormal heartbeat, dizziness, lightheadedness, cold sweats, or fainting. If you experience signs of overexertion, lower your intensity of exercise until you are able to tolerate the higher intensity. Gradually increase time until you are able to tolerate 45 minutes. Then increase speed, resistance, or incline on the treadmill as tolerated. Benefits of exercise: assists in regulation of blood sugar, increases the pumping efficiency of the heart, stimulates the circulatory system, stimulates metabolism, trains your body to burn calories better at rest and during activities, improves muscle strength and endurance, decreases bad cholesterol (LDL) and increases good cholesterol (HDL), lowers resting heart rate and blood pressure, reduces and helps manage stress, produces higher energy levels, makes you feel better. The American Heart Association recommends moderate to vigorous cardio exercise and strength training for heart health. Strength training: moderate intensity muscle strengthening activity at least 2 days per week for additional health benefits. Begin with 1 set of 10 repetitions. Gradually increase from 1 set of 10 repetitions to 12 repetitions and eventually 15 repetitions. Once you are able to complete 1 set of 15 repetitions, easily increase your weight slightly and go back to 1 set of 10 repetitions. Do not participate in strength training 2 consecutive days. If normally high, check BP before weights. Goal: less than 160/100. Flexibility training: the best time to do flexibility exercises is when your muscles are already warm so they can stretch farther without tightness or pain. Always stretch slowly and smoothly into the desired position, as far as is comfortable for you without pain. Tips for stretching: relax and breathe normally while stretching. Hold each stretch for 10 to 20 seconds. A stretch should always be smooth and slow, never jerky or bouncy. This can cause muscles to tighten and may result in injuries. Always keep your joints slightly bent, never locked in a straight position. This can cause injury. Home exercise program: cardiac rehab is 3 days per week. 45 minutes of exercise equals 135 minutes of exercise a week. 150 minutes is the recommended weekly amount. Therefore, to meet the minimum heart health goal, additional 15 to 20 minutes of exercise at home. In order to lose weight, the goal is to exercise 250 to 300 minutes per week. This is an additional 115 minutes of exercise at home. Questions to ask yourself: what days of the week will you exercise? What cardio equipment will you use, if any? How much time will you exercise each day? Remember to not exercise on days that you have already attended cardiac rehab. Questions, comments, or concerns? Thank you for attending this education class.